Good day and welcome to our third lecture video on cervical cancer.
For today we shall dwell on the signs and symptoms of cervical cancer and also on its management. Signs and symptoms of cervical cancer. Cervical cancer often develops slowly over time, and in its early stages, it might not cause noticeable symptoms. However, as the disease progresses, certain signs become more evident. 1. Abnormal vaginal bleeding. One of the most common symptoms is irregular bleeding. This could include bleeding between periods, after intercourse, or after menopause. 2. Unusual vaginal discharge. An unusual increase in vaginal discharge that might be watery, bloody, or foul-smelling can be an indicator. 3. Pelvic pain. Persistent pelvic pain that isn't related to menstruation or other normal causes could be a warning sign. 4. Pain during intercourse. Pain or discomfort during sexual intercourse, known as dyspareunia, can be an indication of cervical cancer. 5. Changes in menstrual patterns. Cervical cancer might lead to changes in menstrual patterns, such as heavier or longer periods. 6. Urinary symptoms. Advanced stages of cervical cancer might cause urinary symptoms, such as blood in urine or frequent urination. Management. Cervical cancer can be managed through various approaches, depending on the stage of the disease. Early detection. Regular screening with Pap smears and HPV testing is crucial. These tests can identify precancerous changes or early-stage cancer when treatment is most effective. Treatment for cervical cancer. The treatment approach for cervical cancer depends on factors such as the stage of the cancer, the patient's overall health, and individual preferences. Treatment options may include 1. Surgery. A. Conization. This involves removing a cone-shaped piece of tissue from the cervix that contains the abnormal cells. It's often used for early-stage cervical cancer or precancerous lesions.
B. Hysterectomy. In some cases, the entire uterus along with the cervix may need to be removed. This is a common treatment for more advanced cervical cancer. 2. Radiation therapy. A. External beam radiation. High-energy rays are directed at the cervix and nearby tissues. It's often used in combination with other treatments. B. Brachytherapy. Radioactive material is placed directly into or near the tumor. It allows for a higher dose of radiation to be focused on the cancer while sparing surrounding healthy tissue. 3. Chemotherapy. Chemotherapy involves using drugs to kill cancer cells. It can be administered orally or intravenously. Chemotherapy might be used in combination with radiation therapy, especially in advanced cases. 4. Targeted therapy. Targeted drugs are designed to target specific molecules involved in the growth and spread of cancer cells. Bevacizumab, for instance, is a targeted therapy that blocks the growth of new blood vessels that tumors need to grow. 5. Immunotherapy. Immunotherapy helps the immune system recognize and attack cancer cells. Immune checkpoint inhibitors like pembrolizumab have shown promise in treating certain types of advanced cervical cancer. 6. Palliative care. Palliative care focuses on relieving symptoms and improving the quality of life for patients with advanced or metastatic cervical cancer. It's not aimed at curing the cancer but at providing comfort and support. Clinical trials. Participating in clinical trials can provide access to new and experimental treatments that may not be widely available yet. Clinical trials play a crucial role in advancing cancer treatment. Multidisciplinary approach. Cervical cancer treatment often involves a multidisciplinary team of medical professionals, including oncologists, surgeons, radiation therapists, and nurses. They collaborate to create a treatment plan tailored to the patient's specific needs. Follow-up care. After treatment, regular follow-up appointments are essential to monitor the patient's progress, check for any signs of recurrence, and address any potential side effects of treatment. It's important for patients to have open and honest discussions with their healthcare team to understand the potential benefits, risks, and side effects of each treatment option. The choice of treatment will be influenced by the stage of the cancer, the patient's overall health, and individual preferences.